years and years to come. So let's not play Russian roulette with the economy and the full faith and credit of the United States government.
Joining me now is Democratic Congressman Peter Welch, who represents the one and only congressional district of Vermont. Thank you very much for joining us tonight, Congressman.
Good to be here.
Congressman, the Democrats are saying that the Republicans voted to end Medicare today. Republicans say, no. They voted to reform and to save Medicare. So I want to read you something from the referee. I want to read you a description of what the Congressional Budget Office says would happen if the Republican plan became law, the Medicare plan. People who are 65 in 2022 or later years and disability insurance beneficiaries who become eligible for Medicare in 2022 or later would not enroll in the current Medicare program, but instead would be entitled to a premium support payment to help them purchase private insurance. That reads to me, Congressman, from CBO, that these people voted to end Medicare.
Well, they did. I mean, that's exactly what it is. You know, Congressman Ryan is saying the cost of Medicare is too much, and I think the Democrats have to acknowledge that the cost of health care, not just Medicare, is too much, and that's why we need to reform the way we deliver health care. But Medicare has been successful because it's an entitlement. It's successful because seniors are able to select their doctor, go to the hospital of their choice, and it really is, in effect, a one-payer. They pay for this throughout their lives, as we all do, and then when they need it, they know it's there. What the Ryan proposal does is basically turn that into a private insurance program. So all of the hassles that all of us experience who are trying to deal with private insurance, those would now become the burden of anyone who's 55 and becomes 65 in 2022. So it really does take away the government-sponsored program of Medicare and turn it over to you, each of us individually, to go buy health insurance in the private market. And what the CBO also said is it would cost every senior about $6,000 more a year. So it would end Medicare as we know it.
Well, it would cost those seniors $6,000 more a year if they could afford a policy that fit them and fit their conditions and fit their situations. There could be many situations where people simply fall through the cracks and they cannot afford the policy that may or may not exist for them out there.
Well, see, that's true. And also, you know, as you know, the Republicans also abolished in the House the health care bill that was passed and sponsored by President Obama. And that had in it some very important insurance reforms so that if you have a pre-existing condition, you can still buy insurance. So can you imagine what it would be like for somebody 55, and most of us by the time we're 55 have some condition that's going to need medical attention, that an insurance company could charge us whatever they wanted or deny us coverage altogether. So that's what awaits us with the Ryan approach on Medicare. It's very, very, very dangerous, actually.
You're in the House today when this vote is being cast. Frequently you can get a feel for what's really going on the other side of the aisle. They knew that this was an academic vote, that this was just a symbolic vote, that they weren't voting on something that was actually going to become law, and that it is a politically risky vote. And everything that we know about the politics of Medicare, just about no one in that building prior to this year ever wanted to cast a vote that ended Medicare the way this vote did. Do you sense that there was some real political fear on the Republican side of the aisle today of what they have brought on themselves in their re-election campaigns by voting this way?
I actually didn't. It hasn't registered yet because this is an abstraction. What I'm seeing in the Ryan budget, and by the way, I want to give him some credit because he was specific and concrete and laid something down that was real. It's when you examine it that you ask yourself, you know, does this make any sense? But he did something he put a real plan down. And what you're seeing is that there's an ideology that's at work with the Republican plan, and that is that revenues are always bad and a tax cut is always good, and it's better to cut rather than to invest. And if you come at what is a very challenging fiscal situation as an ideological battle to be won, as opposed to a practical problem to be solved, then you're going to have people marching over the cliff and things like end Medicare, when that is going to have, I think, very bitter political consequences for them, but also wouldn't work. By the way, you know, in the Ryan plan, the money that he saves by turning this over to the insurance companies and putting a higher burden on seniors, he gives to high-income individuals in the form of tax cuts. You know, he's doubling down on the Bush tax cuts at the high end. And even after doing that, and this is the major flaw of the Ryan plan, we would explode the debt from $15 or so trillion, a little bit under, to $23 trillion in the next 10 years. That's under the Ryan plan.
Congressman Peter Welch of Vermont, thank you very much for joining us tonight.
Thank you.
Joining me now is Washington Post columnist E.J. Dionne.